I've been asked to talk about facelifts and what is it and what's it entail. So essentially, a facelift does not mean lifting the whole face. Right? So you have, as a plastic surgeon, we divide things into thirds essentially. So we talk about the upper third, the middle third, and the lower third. The upper third of the face is addressed essentially by brow lifts. But having said that, Botox and filler, or Botox in particular, has really made the need for brow lifting probably less of a thing. The middle third of the face is addressed partly by a facelift, but more through the lower eyelids. But in particular, a facelift addresses the lower third of the face. So what that means is it's the lines around the mouth, so at the junction of your cheek and the upper lip, the jawline as well, the jowls in particular, this part here, and the neck can all be addressed by a facelift. A neck lift is another separate procedure, but it's often done in conjunction with a facelift because it addresses obviously the amount of excess skin there is in the neck, the amount of fat that's in the neck and chin, but it also addresses the angle between the jaw and the neck to give it a more acute, sharp angle rather than a more blunted, obtuse sort of angle. Look, a full facelift is a big operation. It takes anywhere between 3 to 6 hours to perform under a general anaesthetic, and sometimes people need to stay in hospital overnight afterwards. It is a good operation in that the scars are well hidden, but it does need to be done carefully and properly with appropriately selected patients. So it's not for everyone by any stretch. The results should be subtle but long lasting. So I suspect no one wants to look like they've had a facelift, but you certainly want to look like the clock has been wound back essentially by 10 to 15 years. Obviously it's variable depending on patients. The passage of time still progresses, so the changes that occur to all of our faces with time and age still will happen after a facelift, but the clock should be wound back for a number of, a 10 to 15 year period. What a facelift can't do is that it can't necessarily address the fine lines in the face and the skin of the face. So a lot of the sun damage that can occur in the skin won't be adequately addressed by a facelift alone, and that's where those other non-surgical techniques in combination with a facelift may come into play.